Tom, thank you. A new program at UAMS is not only saving students money, but it's focusing help on some of the most underserved parts of our state.
THV 11's Mercedes McKay shows us why the hospital believes this will keep more physicians practicing in our state.
The program took its first class of 9 students on the Northwest Arkansas campus this July. It all started with a $4.75 million grant, which will allow students to become physicians faster while improving healthcare in our rural communities.
If we don't do this, then the ownership is on us.
As the state's academic medical center, Dr. Susan Smythe says this is UAMS's responsibility.
When we think about physician shortage, we're really thinking about across the state of Arkansas, how we're positioned, and the issues really are in our rural communities.
It's an issue that she says has grown over the years as the population grows, but the number of physicians being trained isn't matching that same growth.
We're having physicians retire, and we just haven't kept up. And so we're now really going to start facing issues.
With a goal to keep this problem from continuing, UAMS created a program where medical students who want to be primary care doctors and stay in Arkansas can complete their degree in 3 years rather than 4, specifically prepping these students in an underserved part of the state.
So that we're really training even more residents in rural communities to hopefully keep some of them as physicians in our rural communities.
This fast-track degree not only helping the students' wallets.
The more debt our students and our residents accumulate, the less likely they are to do either primary care or practice in rural communities.
But the healthcare of our state as a whole.
We'll be able to train highly qualified students in a faster manner so that we can get them into our communities slightly quicker.
In Little Rock, Mercedes McKay, THV 11 News.
Mercedes, thank you. Dr. Smythe says there's a lot of research that shows the earlier a medical student's training that they're exposed to in a specific environment, the more likely they are to practice in that spot.
And this is why they believe training students in rural communities may keep more of them in those areas.